Hello, everyone, and welcome to Public Health in Real Life. Today, we have an exciting program with two extraordinary guests. And I'm Ashwin Kadambi, and this is Public Health in Real Life. This channel is dedicated to celebrating unsung heroes, creating awareness over public health topics, and inspiring the next generation of public health students and leaders. Speaking of leaders, we have two extraordinary speakers with us today. Before going over introducing our speakers, I would like to turn it over to our co-host Chris.
Thanks, Ashwin. I'm Chris. I'm excited to co host on public health and real life. Thank you.
Thank you, Chris. So today we have Gordon Thane and Leshawn Benedict with us. Gordon Thane, let us bring them into the screen here. Hi, Gordon, and hi, LaShawn. Gordon Thane is a program coordinator at Health Unit in Ontario, Canada, where he focuses on addressing substance use, mental health, and the local COVID-19 response. Gordon recently received Health Promotion Ontario's Laurie Chow Memorial Award in 2021 for his leadership and advocacy related to anti Black racism, focus on equity in programming, incredible innovation in health promotion, and dedication to mentoring hundreds of students and early career professionals. He is also the founder and CEO of Public Health Insight. And then we have Leshawn Benedict. Welcome to the program. Leshawn is a community manager for a global health community of practice with over 250 members across 40 countries, focusing on neglected tropical disease programs. Such an important topic within public health realm. Leshawn is a dual certified project management and digital marketing professional, and he's interested in how we can learn and use insights from different sectors and disciplines to enhance public health and global health practice. He's also the founder and COO of Public Health Insight. Welcome, both of you, to the program.
Thank you so much for having us, Ashwin and Chris.
Our pleasure.
Okay, so let us start with Public Health Insight. Can you tell us a little bit? Maybe I will start with you, Gordon. Tell us a little bit about Public Health Insight, its background, and its vision.
Yeah, so Public Health Insight is an organization focused on knowledge translation and health communication, essentially with the goal of bridging the gap between what we see in research, peer-reviewed literature, and knowledge users, whether it's students, public health professionals, or anyone who can use that knowledge. Now, the interesting thing about Public Health Insight is we started as a podcast. So LaShawn, myself, and three others, we found ourselves, after starting our Master of Public Health program, engaging in a lot of dialogue around what public health means to us and how we want public health to be once we started to work. So we had those conversations informally at basketball games. We're talking about public health. We're talking about public health at birthday parties, get-togethers. We're obsessed with public health, and we said, why not get some mics and put it out there? Naturally, you're nervous putting your voice out there for the world to hear, and we mustered the courage to do that, and we put our first episode out. Then there was a second episode, then there was a third, and we realized, wait a minute, you could see your stats, the number of views that you get, and it's not zero. There's people out there listening, and then we kept on doing it, and then we started to get emails, and from our social media, we got messages about how people resonated with very specific parts of our conversations, and then that's when we realized that we had a space in public health, and our voices are valued by a lot of people, and that's where we started. I'll let LaShawn take away the rest of the story.
Yeah, thanks, Gordon. And yeah, Gordon's absolutely right. It literally just started from a podcast and from us just like expressing our passion for public health, and we're huge nerds, to be quite frank. And yeah, we use that as a medium to just express ourselves. And as Gordon started mentioning, we started getting emails, and Gordon and I always had this vision of innovation and entrepreneurship in public health, and we saw this as a potential avenue to you know dial in and focus on that avenue. And so one email turned to another email to hundreds of emails, and we developed into not only just this leading podcast in the public health space, but we started highlighting other community members through our Community Stars initiative. We started to make detailed evidence-informed infographics and posters, started doing live events, and then surprising to us, companies and organizations from Canada and all around the world started reaching out to us and wanted to, do consulting opportunities with us. So it kind of took another swerve, an unexpected swerve that we did not intend. And then a huge thing for myself and Gordon is this mentorship role. As early career professionals starting off Public Health Insight, we were lost too. We wanted to find answers and talk to people who were relatable and in an accessible way. Public health is so broad. So we wanted to bridge that gap. And so through Public Health Insight, we've created a mentorship office hours opportunity where anyone from around the world can join that session free of charge. We've had individuals from India, Pakistan, Canada, the US, all over the world join us for 30-minute sessions to 1-hour sessions and just asking us questions as public health professionals. What do you do? What opportunities are out there? And really questions that are important to them. Then they feel like that's a perfect space for them and a safe space to ask these type of questions and feel heard. So Gordon and I are super proud of that initiative that we brought upon us.
Wow, that's very interesting, Leshawn. Thank you for sharing. Yeah. I have the next question, Gordon. So we have learned more about public health and population health in the past 3 years than ever before. So it has uncovered key vulnerabilities like vaccine nationalism. So can you please tell about how the field of public health has transformed during the pandemic?
Yeah, so public health, I think you can help me out with this quote, LaShawn, but the quote you always hear is public health works when nothing happens. And that's a very hard concept for people to grasp. And I think what you're referring to is, public health largely, for a lot of people in the general public, operated in the shadows before the pandemic. And the pandemic brought visibility on the inequities of what was existing before, as well as how we undervalued our public health systems. Now, the pandemic, in another way, also underscored the importance of those systems and the systems themselves that need strengthening. So that's one key area in terms of the pandemic and public health. And we could talk about a little bit more of where we want public health to go in the future, but I'll digress and let LaShawn add any comments there.
Yeah, I think the pandemic really transformed the public health space, and in the obvious sense of bringing more visibility, as Gordon alluded to and yourself alluded to. But I think it really just prompted us to think about health more so than just the typical clinical medicine aspect. We can't really just stay isolated to that thought only alone, because we have to, as public health professionals and global health professionals, we have to be in tune with fiscal policies, with social policies. We need to understand how education plays a role and how housing plays a role in all this. It all impacts health. So just that main idea of, if we want to treat health, we can't just think of it as just the health sector in isolation from all the other sectors out there. We have to think of housing. We have to think of education. We have to think of business. We have to think of the environment, because these all have key impacts on our health. Okay. So it requires this really a systems thinking and all-in approach to tackle a lot of these issues. And you could see with the pandemic, it wasn't just a North American issue. It was a everywhere issue. So what happened somewhere else impacts us directly. And everyone is starting to make that link and starting to see the systems thinking approach, which is what I saw as the main shift.
Absolutely.
Yeah, and if I could just chime in again, specifically around the point of, I think you mentioned vaccine nationalism, right? Again, countries, with the vaccine procurement, naturally have their citizens that they're looking out for, but there needed to be a paradigm shift in the way we handle different kinds of emergencies. The emergencies that we're accustomed to are more localized, where You can help the people that are directly in need of the help. But this was affecting people all around the world, albeit in different, there was disparities there. So we had a conflict where the selfish desire to make sure you take care of yourself and those around you versus someone who you may not even know. So we had, I think, even present day, there's still so much disparities in the vaccine coverage for different countries, such that some countries might have had a good third and fourth dose rate, and there's some countries that where there's a lot of people that haven't gotten any COVID-19 doses. And then when we talk about vaccine effectiveness or vaccine efficacy, one of the things LaShawn always talks about is everyone is always looking at the percentage effectiveness and they want the best one. How does it make you feel when a country can hoard the so-called best ones, and then whatever gets left over gets sent to the countries that aren't as financially secure? So there's a lot of ethical issues around the way we handle the COVID-19 response, and there has to be a lot of work going into the future to make sure that we're more prepared and that things are a little bit more balanced across the world.
Leshawn, I'd like to just expand on what Gordon just said. This COVID-19, the program by WHO, that it's called COVAX or COVAX, right? They spoke about COVAX right at the beginning of pandemic. The world knew this will happen. Still, it happened despite COVAX. When you talk about preparedness for the future pandemic, what can we do different, or can we even do anything different?
Surely we can do many things that are different. And the main thing is not to chase the next pandemic. We want to get ahead of the next pandemic. And how do we do that? Well, we could have prevented this current pandemic, right? There are a lot of lessons learned from past pandemics that we could have built upon to build that infrastructure, to build communication channels, to build networks of knowledge sharing across the globe, not just focused in North America, but learning from different parts of the world, because they have solid expertise in dealing with infections and outbreaks that we can use in our part of the world. So we need to start valuing that knowledge and having these meaningful conversations. So really learning from lessons from the COVID-19 pandemic. As Gordon alluded to, there's so many different considerations when we're talking about how to deliver, adequate and appropriate healthcare for the population at a population level, at a public health level, at a healthcare level. These are all things we have to consider because we know that populations are not monoliths, right? Yeah. They're all different. They all have different considerations. So we have to have a tailored response. Okay. So there's not really one solution to the question that you're asking. We have to understand the given population's needs. We have to understand what they want, and they have to have a community-driven approach. Now, as governments, as organizations that have the capacity for, funding communities, we have to take the stand and really understand that in order for things to be sustainable, we have to work with each other. And so that goes back into the knowledge sharing, community-driven approaches, and tailoring for the context. There's so many lessons to be learned. We just have to use it, right? Yes. And the lack of knowledge sharing across the globe is quite disheartening, but hopefully we could build upon that. And another point I have to make, because this always happens, is after we overcome this pandemic, and it's still raging all around the world, we don't want to stop this fight in public health. We don't want it to go to the back burner. We want to continue sustained support and funding to public health infrastructure, because that's going to be what's going to be important for identifying the next pandemic before it arrives.
Yeah, and if I could chime in on that as well, one thing that's not often talked about is scientific literacy and health communication, because ultimately governments can decide what an appropriate response is. They can implement policies. Ultimately, pandemics are driven to some extent by human behavior. And if we can't even agree on certain basic scientific facts about what COVID-19 is and what vaccines do, then we're fighting a losing battle. So I think even at the grassroots level, even at the most upstream level, we have to do a better job at enhancing scientific literacy across the board, from when people are very young, get them to think critically about information, And we have to figure out how to stop the weaponizing of information. That, someone can be considered a good or bad person based on their vaccination status. That polarizes our society even more. So there's a lot of more existential issues that need to be addressed in terms of pandemic preparedness, because we can have all the masks and the thing ready to go in a stockpile, but if people don't believe in masks, they're not going to wear them, and then it doesn't matter what you do at that point. So it's important that we focus too on feeding the brains and getting people prepared to understand scientific information. And as health officials, health communication, we have to admit that we sent a lot of mixed messages around masks, travel, vaccines, that we understand it's very nuanced, but we have to do a better job at communicating that to the general public.
That's a great one, Jordan. So yeah, Lashan rightly said two different strategies. One is a sustainable approach, and the other one is a systems approach, a holistic way of thinking. So that's a great one. Thank you so much, Lashan and Gordon. Yesterday, let me switch gears now. Yesterday was a historic day in the United States. The Supreme Court overturned Roe versus Wade. Reproductive rights and women's rights are only becoming vulnerable worldwide. What is the role of public health leaders in bending the arc of the universe towards justice?
Okay, I'll take that. So, our role as public health professionals, I keep saying we need to be holistic, we need to think outside the box. We must protect sexual and reproductive rights. And as public health professionals, our role is to ensure we can create the conditions necessary for healthier communities. Anything that compromises sexual and reproductive health rights, by definition, is in conflict with creating these healthier conditions for these communities. And so restricting reproductive rights and abortion access doesn't reduce abortions. It just makes them unsafe. So we have to fundamentally ask ourselves as public health and global health professionals, is this a step towards healthier communities? Right?
Yeah. I mean, I'm not, by no means am I an expert in sexual and reproductive health, but there's a couple points that I would like to say. So the first thing is, how was that decision arrived at in the first place? So I think one of the challenges with a lot of policy making is that, one, you don't have public health professionals at the table when certain decisions are being made. And then two, what is the gender representation at those tables that are involved in making those sweeping policies that affect an entire country? Access to abortions, that it's essentially healthcare. And an interesting thing about, when we think about Canada and the US, is abortion is treated a bit differently. Abortion is seen as a healthcare issue more so in Canada, and in the US it's seen more of a human rights type of issue, in which the Supreme Court can influence and control that. And that one, we'll talk about this, I'm sure, in a moment, but the intersection of politics and public health and population health gets really, the lines get a little bit blurred, and things don't go our way all the times. And we have to make sure that we have a more sustainable way to navigate that. For example, every time there's a change of power, depending on what party goes in, we can't keep having this seesaw approach to a lot of these policies that are out there. So we need to figure out what things are public health issues, and what things should be dictated by politics and government.
Right. Speaking the same thread, Gordon. So, we see that politics has a direct effect on public health, from policies to funding to recognition of issues. And health is public health, at least, it's still spoken as do good, feel good, social determinants of health, trying to get this, giving access to people. But there needs to be an element of fighter attitude. You don't need to fight, but that attitude should be there to defend public health, to ensure that we speak in meetings, to ensure that health gets to rural communities, in communities where there is not representation in the table. um, but that's not the way we educate the students, right? So what needs to change in how we educate kids, about public health as a social justice for which you need to fight for every day?
Yeah, I would actually even, that's a very important issue that you raised there. And I would actually maybe push back a little bit and say that the new generation, they tend to fight more for social causes in a sustainable way. When we look at the dichotomy between that and those who are in office, we have to start looking at the underlying motivations by how some decisions are made.
Right.
Before we went online, we were talking about the importance of evidence-based public health practice, evidence-based decision making. You just talked about Roe v. Wade. What is the evidence to suggest that overturning that is a good thing from a health perspective? Is the evidence being reflected in the decisions that are being made? So there's a lot of things that have to happen upstream as well for us to make the right decisions, because ultimately we can advocate from a grassroots level, but the people who we're electing to make those decisions, we have to hold them accountable to the evidence, and that's the way things have to get done. That being said, evidence can change. That's another hard concept. So go back to COVID-19. We didn't know how it was spread. Then we thought it was spread this way. Then we thought it caused certain symptoms, but not others. Evidence evolves. So people have a hard time understanding that, including those policymakers and decision makers. But in terms of the starting at a grassroots level, I think we're doing a better job now at stripping away all the things that were in the shadows. We talk about issues like racism. It's very evident now. There's data out there to support this. Before, places would just simply not collect race and ethnic based data because they didn't really want to know what disparities were out there. Now we have a lot of that information in many of these cases, and we have a foundation to move forward. The issue becomes really, when we're talking about it, is how to get things done. So you talked about it's nice to know about what social determinants of health are, health inequities. Everyone knows all the buzzwords, but how do you move from buzzwords to action? And I think that's where we're really lacking. Leshawn and I, spend a lot of time and even stay awake at night sometimes wondering how we're going to address the challenges of today and tomorrow. And a lot of the times you don't learn those skills in school. Some of those skills, negotiating with people, interacting with people, interacting with people, how to manage projects. So, you advocate for the funds, you have unlimited resources, and yet we still have the same issues and we don't solve those issues. So it's clearly not an issue of resources all the time. Sometimes it's a matter of lack of resources. So we have to really, one of the quotes I really like, and LaShawn's going to roll his eyes here, but a quote by John Dewey, he says, "A problem well defined is a problem half solved." A lot of times we're not talking about the same problem, and that way we can't get on the same page with a solution.
Yeah, no, I totally agree. And like when we're talking about this, do good, feel good approach, it happens quite a lot in public health and global health. We're preaching to everyone who already knows about public health and loves hearing what you have to say, right? Because it's what we've learned, it's our perspective. So really we should, one of the key approaches that myself and Gordon take is really taking the time and learning how to speak the other people's language. So by that I mean, we have politicians, we have scientists, we have the general public, we have business people, we have marketers, we have social media experts, we have law and ethics professionals. It's easy to do the public health blah 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 to each other as public health professionals, but in order to do that and make the action and have that fight that you're talking about, we need to have that meaningful connection and collaboration. So we need to be those individuals as public health professionals to have those dynamic conversations with many sectors and many actors and really understand the environment in which they sit, because that's key. You could talk all the blah, blah you want, but if it doesn't evoke change in the person and you can show how your values align with them, you're not going to be able to push the right buttons to enact change. So how comfortable are you talking to an economist about public health issues? You need to be able to know your numbers, to speak in their language. So that's what I mean by that.
And how comfortable are you talking to someone you disagree with?
Yes.
You're right. That's why we never get anywhere. The solution is to, let's just put people in power who agree with everything that we say, and we are unwilling to have a conversation with people who fundamentally disagree with us, and we write them off as essentially bad people. I don't that might be true in some cases, but I don't think that's a solution to address the problems. One example that I was astonished by from reading a book on health communication is around climate change. And simply once you say the phrase climate change, people with certain ideologies automatically tune out. But if you talk about it as essentially a climate that's changing, and you talk about the factors that contribute to it, you're able to move past the putting the foot down and saying climate change doesn't exist to addressing some of the real challenges that climate change poses. So we got to stop talking at people and talking with people. That's what I would say.
Understanding how to reframe the narrative for sure is important, and that comes
right.
to the point of negotiation. You have to be able to be able to communicate with others.
Yeah, wow, that's awesome, Gordon and Leshan. Communication and negotiation are the key. You have interviewed several fascinating public health professionals. Can you please share a few common leadership skills you observe among the successful public health leaders?
You want me to kick it off? Okay. So one of the things that from interviewing so many different public health and global health professionals on our Public Health Insight podcast is they don't specifically state it, but I feel like this is what makes them an effective leader. It's their ability to rethink the way they think, if that makes sense. And this is a concept Gordon and I learned about through a book called Rethink by Adam Grant. And it really talks about we do a really good job clinging to our tendencies and beliefs and just sticking to them, gung-ho about them. But in order to be an effective leader, you have to be able to rethink the way you think. Our world is ever changing. There's so much going on. Evidence, as Gordon says, is always being developed and changing. So we can't fall behind in this evolving landscape. So being able to respond to this ever-changing environment by actively seeking ways to confirm what you believe or disprove what you believe, I think it goes a long way. And it's through having conversations and looking for ways to be proven wrong, not being held so strongly with your belief, but to be a bit flexible in a way. I think that helps stimulate your overall conversation. And as a leadership approach, being able to hear different perspectives from people that don't agree with you, that's going to lead to more successful and fruitful conversations and collaborations. So I think that's one of the things I've gleaned from a lot of these interviews that we've been having. Gordon, what would you say?
What I would add is that what we've garnered from, in terms of themes from engaging with people on the podcast, and even just people in our network, the best leaders often tell us that they're not the smartest in the room, right? So a good leader is not one who knows everything. A good leader is one who knows what they don't know. And then they surround themselves with those who can do a better job at those things that they don't know, the blind spots that they have, and people who can supplement their weaknesses. So leader is someone who recognizes and has a great sense of self-awareness, a great sense of humility, and one who's able to motivate and influence those around them. Because you could publish 500 million paid peer review articles. You can know everything there is to know in public health. But like we said, those interpersonal skills of being able to negotiate, communicate, influence, manage, those are how you actually get things done. And I think that's where things get lost a little bit. Communication skills, having a discussion is not arguing with each other. It's, actively listening, repeating what someone says, understanding where they're coming from as a first step, and then going from there. So that's what we hear a lot from our leaders that we engage.
That's something. Thanks, Gordon. Thanks, Leshawn. We have an audience comment here, question from Alex Adiomi. In this age of political division and divisiveness, how do public health and global health practitioners and champions advocate for key global health issues? I think we are revolving a bit on the same subject, but still, do you have any additional comments in this subject?
I think the person who comes up with a very coherent answer to this probably will get a Nobel Prize.
Yeah.
But I will say, hate to circle back to the same point. We're losing ourselves in society, and we're polarizing ourselves by surrounding ourselves with only people who we agree with, and this is very problematic.
Right.
Even just if you look at we're live streaming to YouTube, if you watch a certain type of video on YouTube keeps feeding you back similar types of videos, and then that's problematic because it limits your knowledge base. It limits your ability to look outside of what you know to get answers to the questions that you might have. It
Right.
makes us not want to take the initiative to learn about different points of views, and I think that in of itself is very problematic. In terms of public health, I would say for me, I think it became apparent to me in training while doing my Master of Public Health program how much intersectionality existed with public health and politics. That's not something that I think a lot of people expect. People expect to get their degree, people expect to go out there, and people expect to go out there and do their job. But what if the existence of your program is being threatened because the government is changing its policy? So you have to have certain skills to be able to advocate for issues that are important to your community. Now, one thing that gets missed as well is depending on the type of government you have, they might have different priorities. Things might be different in terms of stating the importance. Some types of government might be more interested in cost savings. Some governments are more interested in the cost of human lives. So you have to be able to make an argument for whichever type of government that you have to justify whatever program or services that you're offering to advance the health of the communities. So that's where public health has to do a better job of being more flexible and adaptable, being more a higher sense of political acuity to be able to navigate those waters, to be flexible. And because it can't be a doomsday every time there's a political cycle. That is not sustainable. So we have to figure out how to stabilize certain core public health issues to make sure that there's less disruptions for those who benefit from those programs.
Mm-hmm. And to add to that, and Gordon also slightly covered this, is as emerging public health professionals and students, we want to make sure that our efforts are targeted and pointed. So if we're advocating for a specific issue and we want to enact change, we want to make sure that that advocacy and that effort is being pointed to the right jurisdiction, whether it's municipal, whether it's provincial, whether it's federal. So to have that political tact and understand your political structure and your governmental structure goes a long way to have that targeted and pointed advocacy effort.
Let me add one point there, Leshawn. I just want to expand on what you're saying. You have background in neglected tropical diseases. And neglected tropical disease was named neglected tropical diseases before the pandemic, right?
Yep.
So during the course of the pandemic, probably it was part of the national budget in many of the low and middle income countries before the pandemic. Once the pandemic came in, probably in that list, neglected tropical disease was not even part of the list. Now, what's the challenge we are facing in those situations?
Yeah.
It's pretty challenging to see diseases like the leishmaniasis or the river blindness.
Yeah.
These are all
Onchocerciasis, yeah.
There you go. So those are some diseases that's not even not even budgeted for in the national public health. In those situations, this topic of this interview is changing global landscape, right? Of global public health.
Yeah.
So what are we seeing as changing in this landscape? What are the positive things and negative things?
Yeah, that's a great question, especially when talking about such an interesting field like neglected tropical diseases. And for those of you that may not be familiar, it's a group of 20 disease groups as defined by the WHO. And as you mentioned, leishmaniasis, Chagas disease, lymphatic filariasis, onchocerciasis. There's a lot of different disease groups that fall within that bucket. And the thing with neglected tropical diseases is they don't necessarily kill you right away. It's more of these debilitating, long-lasting, very nagging injuries and disfigurations that occur to you that make your quality of life really, really go downhill. And it's very unfortunate. And you're very right in saying that, as priorities shift, like the COVID-19 pandemic, neglected tropical disease priority in different programs go down quite a bit, right? And now those are some of the challenges. So a lot of communities suffer. They don't get the same funding and attention for those specific diseases that ail their communities. Now, in terms of successes, and this is a thing in the field that we're continually trying to get better at and do more of. It's this integrated, it's this collaboration focused and working together across disease groups. So let's not focus on vertical integration of programming and focusing on specific neglected tropical diseases. Let's talk to malaria people, malaria folks who are doing great work in the field, already, creating relationships within given communities. And as neglected tropical disease people, when we're disseminating drugs through mass drug administration, let's work with them and plan together. So we are able to have this double effect instead of just working in isolation. And when you see funding for neglected tropical diseases going downhill as a result of global priority changes, we want, as public health professionals, we want to piggyback off of other great initiatives and work together to make sure that we're able to have longer lasting sustainable impact. So there's been a lot of collaboration going on with a bunch of disease groups. And, as neglected tropical diseases lose that focus, we're looking at different partners across neglected tropical diseases, malaria, TB, etc., to learn from their lessons and collaborate with them on a lot of their health campaigns. So that's kind of one of the successes I see. And it's something that we're working towards. In neglected tropical diseases, the WHO released the 2021-2030 roadmap, which talks about integration of services, community-driven approaches. So we need to put that at center. And I think those are things, as the neglected tropical disease community continues forward, those are things that we're looking forward to and actively open to and participating in.
That was a good one. Thank you, Leshawn. And to you, Gordon, you speak to students around the globe, and sorry about it. You speak to students around the globe on different public health issues, and there is increasing interest in students pursuing public health degrees like MPH, PhD. Yet, not only in high income countries but in low income countries, not only in low income countries but even in high income countries, you see that there's not much support to students pursuing public health. There's no public service loan forgiveness programs aimed at public health degrees, or even the entry level positions for public health is still it's unless the student has additional skills. It's not, we cannot compare it against other masters, technical masters degree. How can we change this landscape? Should the institutions take steps? Should the industry take steps, or the government take steps? Who is involved here, and what can we do?
No, that's a tough question, because we're talking about competing priorities or competing resources. Public health is valued, but other industries feel like they're valued as well, and they might be in a similar position as public health. And then, who deserves to end up on top? So there's a lot of questions around how that plays out. But I do agree with the premise of what you're asking, that it can be inaccessible for a lot of people. It's in many cases it's not affordable. Prices vary quite a bit depending on how you pursue your education, but there are quite a few where the costs are very exorbitant. And you made a reference to entry level positions. The salary not matching up what you invested into your education, which is another problem in of itself. So we have the problem of public health programs not receiving subsidies or different types of funding to make it accessible, or scholarships. And then you get through that, and then you go into a job market where your skills maybe not as valued as maybe in the IT sector and the software engineering and that sort of thing. And perhaps there's not as much funding in the public health industry, which then goes back to government itself for not funding the programs that are going to pay your salary. So all fingers point back at government. We have to also make sure as well that, one thing I think that's important from my perspective is we have a lot of different public health jobs. And a lot of times, they don't list the salary expectations on their postings, and we know it's a lot of work to do job applications, and then you go through all of that to learn that what they're offering is way below maybe even the current job that you're about to leave. So we need to have a little bit more transparency around that as well, in my opinion. And we need to make sure that our programs are more accessible. Even if loan forgiveness is a good place to start, even partially, or have a pot of scholarships or grants for people to at least cut the costs of their education. I know there are some programs that help around this. There's some in terms of practicums that you do in your Master's of Public Health. You can get some paid opportunities there. You can get field placement opportunities after you graduate, but that's a very patchwork approach to the problem, and there's still a long way to go. But yeah, unfortunately, I don't have the answers for you. I was in a similar position, having to take out a pretty large loan from the financial institution to be able to pay for my degree. And because of that, I had to also work during my program. So then that puts undue strain on not just me, a lot of people, I'm sure, in similar positions like that. And we just need to make it less of a burden to pursue a public health education. I think we can all agree on that.
Yeah, I think just to add there, one of the points I would like to contribute would be looking at institutions that train public health professionals. We want to take a 21st century approach to their training, right? We don't want to just talk about the social determinants of health and health equity and those core concepts that are foundational to any public health program. As Gordon alluded to earlier, we need to talk about the how to do things. Like how do you do projects? Like Gordon and I talked to hundreds of public health professionals through our office hour programs, and a lot of the time after graduating, they're like, honestly, we talk about this, but like, how do I do it? And that it just struck me. It's like we're learning all this great thing. We're talking about a degree that they might not get compensated as much as they want. How do we make these skills more scalable and appealing in the job market? Project management is a great way to start. It tells you the how to, thinking about practical considerations. What is the scope of the project? What is the time considerations of a project? What is the cost of a project? Things that public health professionals may think of, but it might not be the first thing they think of. And when you're working into the framework of an organization that you're hired at, you sure as hell want to understand their different barriers and facilitators in order to have your way with any sort of initiative, program, etc. So having the know-how and then knowing how to do it, which comes in the form of project management, is something I advocate for in any MPH program or public health program, which in my opinion, I haven't seen a lot of. And again, even moving past that, and I might be biased, but even digital marketing skills, we more and more live in a world that's digitalized and virtual. How do you navigate that experience? That's something to consider going forward.
Yeah, and if I could add, that's a great point. And I'm glad, I was hoping that we would get to this before we concluded the session, the public health training aspect. So you learn a lot about how to be effective in an ideal world in public health. There's X% of people with a burden of disease, and if only we could get $100 trillion, we could solve it. That's not the case.
Doesn't work.
Oftentimes you're operating under resource constraints, and you have to use every effort to maximize the dollar that you have to be able now, and that's skills that we don't learn explicitly in public health, at least the programs that I'm aware of. Right. And this challenged Leshawn and myself to think about, we learn about the core competencies in public health, advocacy, we have the public health science knowledge translation. That's all well and good. What about those transferable skills that would make you an effective practitioner in general, no matter what industry you're in? So of course, leadership, we're talking about managing projects, managing resources. That's very important. We're talking about, evaluation. That's something that marketing, like Leshawn said, digital marketing, other industries as well are evaluating, shows how effective something is. We understand that it's hard when we're talking about things like more chronic diseases. Right. The impact of an intervention, if you're measuring the ultimate output of if someone got diabetes or not, you won't see the impact for years, right? So we have to do a better job in terms of our measurements to be able to really quantify the impact that we have. And that goes back to the idea of how to as well. We need to be more flexible, innovative in the way that we do projects and the way that we understand the level of effectiveness that the project had.
Right. And those are really good points, Leshawn, Gordon, because it's like almost every public health student needs to have skills of an FBI officer. I don't know your Canadian
Yep.
equivalent, but
Yep.
so you should know enough about microorganisms and macroeconomics.
Yep.
And you don't need to be like a mechanic, but at least a driver of all of the different skills. And I understand definitely, the schools can do a little bit better in giving some of those job relevant skills,
Yep.
and also industry being more explicit with what their because many of the consultancies that we see, they are answerable to their clients, so their employment needs are basically based on what the client needs. But oftentimes, when students or anybody applies to consultancies, they think that they are applying to a job. It's not a job. You're serving the consultancy's client, right? So we need to make that kids need that. Not only kids, like all public health professionals need those skills to understand what the end goal is. But this has been a really informative interview, and you mostly sat at the other end, also questioning guests in your program, and I hope this experience was good for you to also learn about yourself, because I learned a lot about. I've seen a couple of your programs, and I um, recommend all viewers of this program to explore Public Health Insight. They have a wonderful website, a podcast. It's the user friendliness is awesome in the website, and even the podcast, the depth and breadth of information they speak about is just mind blowing. And just listening to that podcast on a weekly basis itself will give you that knowledge from the what we spoke about, microorganisms to macroeconomics. They cover all that, so we strongly recommend this viewers of this program to also explore Public Health Insight. Over to you, Chris.
Thanks, Ashwin. Yeah, as Ashwin rightly said, Gordon and Leshan, you're doing a really amazing job in public health arena. So, how can the viewers connect with public health insight and with you both?
Wonderful. Yeah. First of all, thank you, Ashwin and Chris, for this wonderful program. And, public health in real life is an amazing resource for a bunch of public health professionals out there. So we'll definitely put a link in our social medias as well, because you guys are doing excellent work, as well as the people in the back end making this possible. So thank you so much. Now, in terms of Public Health Insight, a quick Google search of Public Health Insight will lead you right to the website. Also, if you're looking at Twitter, Instagram, YouTube, LinkedIn, we're pretty active in all of those areas. So by simply typing Public Health Insight, you should be able to come up with any of our profiles there and connect with us there. And again, we do a lot of different educational content and a lot of professional development stuff. So again, like I said, Gordon and I love implementing different skills from different sectors and industries into public health practice, because we think it makes it more effective. And it's something that for a broad field like public health is a must. So yeah, that's how you would reach us. And you could also feel free to connect with Gordon and myself on LinkedIn by just looking up our names, and you should find us.
Thanks, Leshan. Thanks.
Gordon, anything to add?
I mean, if you get, I can add one or two last words here. Leshawn knows I can talk a lot, but I promise I won't be too long. The theme of this conversation, I as I understand it to be, is around the changing landscape of global public health practice, and none of us really knows what that means. But what it really means at an individual level is you, as a public health practitioner who wants to leave a mark in the world, wants to have a positive impact, it's up to you to look for ways to do that. Leshawn and I found project management as a way to be more effective in our work. Because we're committed to continuing learning even after we complete that long degree, we're stressed out, we're burnt out, you have to take time for yourself. But when you recuperate, you always have to continue to develop new skills that are useful to your job or the job that you want to get in the future. So your learning never stops once you graduate or when you get the degree. And the skills that you learn might be different from the skills I need to learn, but you have to be able to look at what the future of public health, the direction it's going in, and be able to morph and get the skills you need for the future challenges that you'll see.
Wow,
Perfect.
great one. Thanks, Gordon.
Perfect way to bring this program to conclusion. So thank you again, both Leshawn, Gordon, and Chris for co-hosting this program. And until next time, this is Ashwin. See you all.